Dear viewers, very good evening. My name is Rahul Desai, and on behalf of FDC and Med Talks, I hereby welcome you all into our last episode of our journey in hydration diabetes. Dear viewers, these modules are an educational initiative from Enazal Zero and in memory of late Dr. K.K. Agarwal sir. We had begun this journey 7 episodes back, almost 2 months back, to highlight the role and importance of hydration, not only in us, but specifically in diabetic people also. Diabetes is India's fastest growing disease, with almost 72 million cases recorded. And for people with diabetes, the heat and humidity of summer can be very particularly hazardous if adequate measures are not taken to ensure lifestyle changes. Even when it doesn't seem very hot outside, the combination of heat and humidity can be dangerous. One of the complications of diabetes, both type 1 and type 2, is an impaired ability to adjust to rising temperature, which can cause dangerous increase in body temperature during summer. So before I hand over the platform to our host, Dr. Kalra sir, and our today's speakers, let me have the opportunity to introduce them to you. Dear viewers, Dr. Kalra sir is President-elect of South Asian Federation of Endocrine Societies. He has done his DM endocrinology from AIMS New Delhi and Fellow of Royal College of Physicians from Edinburgh. He is currently practicing as consultant at Bharti Hospital, Karnal. He is the past president of Endocrine Society of India and board member of International Society of Endocrinology. He is the president of Indian Professional Association for Transgender Health, section editor of endocrinology of API Textbooks of Medicine, and section editor Tropical Endocrinology Endotext PubMed Index Textbook. Moreover, our today's speakers, Dr. Paritosh Baghel, has completed and is one of the most physician practicing internal medicine in Mumbai for over more than a decade. He has completed his MBBS from Grant Medical College and Sir JJ Group of Hospitals in Mumbai in the year 2003, and MD Medicine from GS Medical College and KM Hospital, Mumbai in the year 2008. Currently, he is practicing at SL Raija Hospital, Mahim, with more than 12 years. And our second speaker, Dr. Saurabh Arora, he has done his MD DM endocrinology and currently is the assistant professor, Department of Endocrinology at Dayanand Medical College, Ludhiana. So before I hand over the platform to Kalrasa and the speakers, let me have the opportunity to announce the winners of those doctors who have answered the quiz question correctly in the last episode. And the winners are Dr. Shashi Khare and Dr. Suresh Pawar, both from Maharashtra. So congratulations. And viewers, I would like to inform you that we have started season 2 of Diabetes Essentials. And this Sunday, we are having a session which is very interesting and a very exciting topic for all of you. So do log in at 9 p.m. on Sunday at the same platform. With this, I hand over the platform to all our speakers. So over to you.
Thank you, Rahul, and greetings to everybody who is gathered with us today. We'll be talking today about a very simple thing, as simple as water. I'm reminded of this novel, Silas Marner, where the author says he's describing, or rather the author is describing a housewife. And she says about the housewife, she ran a beautiful home, a very efficient home. Her table was full. Her dining table was full, yet not a single grain of salt was wasted. That's the importance of water. Water is important. It's just like salt. It's essential for health. But we shouldn't waste it. We should take water as much as is required, but we should preserve it as well. Over the past 2 months, 2.5 months, we've spoken about various aspects of hydration. And in each episode from our expert speakers, I've learned a lot. I've learned about how water can be used for primary, secondary, and tertiary prevention of disease. I've learned how water can be used for primary, secondary, and tertiary prevention of diabetes as well. But now summer is upon us, the great Indian summer, and we need to learn more. So we have with us our two experts, Dr. Saurabh Arora and Dr. Paritosh Baghel, and they'll be speaking with us about various aspects of water, heat, and health. So warm welcome, Dr. Saurabh. Warm welcome, Dr. Paritosh.
Thank you
We
so
already
much.
have lots of questions coming in from the audience, and we'll take them one by one. But Dr. Saurabh, would you like to kickstart the discussion? And we have a question for you from the audience. The question is, Dr. Saurabh, you are from the state of Punjab. What is your favorite beverage?
Punjabis are fond of, especially in the months of summer, Punjabis are fond of lassi, we called here. Uh, that is actually very soothing. Especially in the months of summer, we do consume a lot of lassi here in Punjab, and it's my favorite.
So buttermilk. And Dr. Paritosh, the same question for you. Mumbai is
Yes.
known as the street food capital of the country. So what is your favorite street beverage?
Yeah, sir. So, uh, as Mumbai, as you know, it's known for its street food, and but this time, unfortunately, there's so much of summer. I mean, the heat is so much that everyone is just wanting to have some or the other beverage. If you ask me, I generally like buttermilk, which is very common, and it's one of the favorite among if you look in Maharashtra and Mumbai per se. So, buttermilk is my favorite, and I think that's a good drink to have.
So same answer coming from both our speakers, Dr. Saurabh and Dr. Paritosh, buttermilk or lassi or chaj. But let's ask everybody in the audience, would you like to share in the chat box, what is your favorite beverage? And while we wait for your answers, Dr. Saurabh, why don't you kickstart today's discussion?
Sure, sir. First of all, I would like to thank you for giving me this opportunity. And today I will be talking regarding hydration in diabetes. And I'll be talking regarding water and heat balance in the body. As we know that temperature is tightly regulated in the our body, and even a slight disruption in this temperature regulation process can have deleterious consequences, especially in the months of summers. Can you please add the slides? Yep. Uh, can I have my slides? So, especially in the months of summers, there is a group of population which is vulnerable to the effects of heat, and I'll be talking regarding those population like elderly population, pregnant females, or patients with underlying disease like diabetes, underlying cardiovascular disease. These group of people are especially vulnerable to the deleterious effects of the heat. And as we know that, just take an example of diabetes. If I speak of in patients with diabetes, the temperature regulating processes are disrupted, like the sweating is suboptimal in patients with diabetes. Diabetic patients are not able to increase the blood flow to that extent that a normal patient can do in response to heat. So these all changes in a patient with diabetes can result in various adverse effects of the heat, like patients are more prone to have heat stroke, heat exhaustion, and heat cramps. So heat cramps generally occur in patients due to the loss of water as well as electrolytes due to the excessive sweating. So, coming to heat and health key effects. So, we know exposure to excessive heat has wide variety of physiological impacts, and it has negative health impacts of heat predictable, and these effects are mostly preventable. And excessive exposure to heat can amplify the pre-existing conditions, like if the patient is having underlying cardiovascular disease, and uh, the patient is exposed to extremes of temperature, that patient can develop acute coronary syndrome or worsening of the heart failure in response to the heat. And there are some studies and even meta-analysis to show that this can result in premature death and disability. So next slide, please. So, who are the one most affected from the extreme effects of the heat? the less able, pregnant or already infirm, poor, displaced or homeless, children and elderly, athletes, outdoor and manual workers are more affected as compared to the normal population. Next slide, please. So, how does heat impact the health? A rapid rise in heat gain due to exposure to hotter than the average condition compromises the body's ability to regulate temperature. So, resulting in cascade of illness like heat cramps, heat exhaustion, heat stroke, hyperthermia, and it can lead to exacerbation of underlying cardiovascular disease, underlying respiratory illness, or cerebrovascular disease and diabetes-related complications. So, next slide, please. So, various indirect effects of excessive exposure to the heat include increased ambulance call-outs and slower response times. There is illness can lead to dehydration, heat cramps, heat stroke, respiratory disease, various exacerbation of various cardiovascular diseases, and increased rate of hospitalization is observed with increased exposure to the heat. Next slide, please. So, what can we do to prevent these complications? So, we have to keep the body cool and hydrated. We have to drink plenty of fluids, even if someone is not feeling thirsty, but the temperature is hot and the climate is humid. So, we need to drink plenty of fluids, and it's better to avoid alcohol and too much caffeine and sugar. And it is advisable to eat small meals and eat more often rather than eating a large meal at only few times a day, and high protein diets to be avoided, especially in the very hot climates. Next slide. So, according to the CDC, drink more water than usual and don't wait until you are thirsty. Uh, Next slide. Uh, if someone is feeling unwell in the hot atmosphere, so it's better to move to a cool place, measure body temperature, get help as soon as possible, to drink water or fruit juice so as to rehydrate. So the person is advised to rest in a cool place in case of painful muscular spasms, and very important is to drink oral rehydration solution containing electrolytes, or if that solution is not available, simple water can be taken at that moment, and medical attention to be sought if the cramps exist for over an hour. So, immediate medical help is needed if unusual symptoms are seen or symptoms persist. Next slide. So, what are the nutrient requirements for Indians? So, it is adult man requires around 32 to 50 ml per kg uh, body mass of water. Adult woman, the daily requirements are 27 to 50 ml per kg body mass. For children, it is more than 60 ml per kg body mass. For adolescent boys, it's 47 to 60 ml per kg body mass. In pregnant women, it is 2.1 to 3.2 liters per day. For elderly sedentary males who are sedentary, 33 ml per kg body mass, and more is required if the activity is more like 40 ml per kg in elderly. Next slide, please. So, the first question is, what is the recommended water intake for an Indian sedentary elderly man? So, we have four options, that is 32 to 58 ml per kg body mass. Second is 33 ml per kg body mass. Third is 38 ml per kg body mass. And fourth is 47 to 60 ml per kg body mass. So, and the second question is, which of these is not a heat related condition? Heat stroke, migraine, heat cramps, heat exhaustion. uh, can I have mine slides also, because I have a different slide set just to show the difference between heat cramps, heat exhaustion and heat stroke. So, heat stroke is an extreme condition with excessive exposure to heat. when the body temperature rises abruptly, and these changes are seen within 10 to 15 minutes after exposure to heat. And in this condition, body temperature is more than generally 106 degree Fahrenheit, and patient can be in altered sensorium. Patient can be in unconscious state in patients with if the patient is having heat stroke. And heat exhaustion, it's also a severe form, but less severe than a heat stroke, where the patient tends to have high body temperature, but generally the sensorium is intact and the body temperature is not that high. And in all these conditions, the immediate need is to rush to the hospital. We have to uh, and if hospital is not nearby, if we are dealing with a patient of heat stroke, so various methods for cooling, like applying ice or applying cold water on that patient, so that can be, these are the temporary measures which can be helpful while waiting for the um, ambulance, and while during transportation these measures can be adopted. And another is, with extreme exposures to heat, there are cases of rhabdomyolysis. Even the patient tends to develop a rhabdomyolysis. Rhabdomyolysis is a condition where proteins break down, and ultimately high amount of amino acids, uric acid, and there can be increased potassium in the blood, and all these changes can cause a renal failure. So we do CPK and urine for myoglobin to detect these changes. Patients can have renal failure, and we need to have a high index of suspicion to diagnose the color of urine changes in this condition. And less severe conditions due to heat exposure include heat cramps, uh, and where we can have salt and electrolyte loss, and it can lead on to cramps. And other thing is heat syncope, a transient dizziness or fainting while standing from a sitting position, or during a standing position it can occur spontaneously. It's for a very short period of time. Patient regains consciousness within just a period of seconds. So almost in all these conditions, the foremost priority is to rehydrate the patient and to keep the temperature as cool as possible, and we have to shift the patient from the hot environment. So that's all. Thank you.
Thank you, Dr. Saurabh. Good discussion, and you've been able to highlight the common conditions that we see in summer: heat cramps, heat exhaustion, heat stroke. Lots of questions coming up for you, but perhaps we can ask Dr. Paritosh to handle some of them, especially the difficult ones. So,
Yeah.
Dr. Paritosh, how common in your practice are heat cramps, heat stroke, heat exhaustion?
There has been a rise in the number of cases now this year, although not many cases of heat stroke have come to us. But the lesser forms of heat-related illnesses like the heat exhaustion or heat cramps are very common, where people do come. Those, especially those, as has been highlighted by Dr. Arora, regarding the vulnerable population, the elderlies, the extremes of age, and the people who have been working in the hot sun. So yes, there has been an increase, and in this recent years, we have been seeing a frequent number of patients presenting with giddiness, with exhaustion. Uh, so there has been an increase, sir. I would say, on an average, I would be seeing at least one or two patients in my ER or in my OPD.
Every day. So that is
Yeah.
a significant number.
Significant.
We have a question from Dr. V.K. Goel, who talks about the various medical grade formulations that are available, electrolyte formulations. So he's asking, we have multiple names like Electral, Enerzel Zero, Enerzel Blitz. Which one do we use in heat exhaustion? Which one do we use in people with diabetes, without diabetes?
Well, when we look at heat exhaustion is a form of a volume loss. I would say that it is like the patient has lost good amount of fluid, and he has not refilled his body with fluids, and that leads to heat exhaustion. Because of the fluid deficiency, the patient feel exhausted. There would be cold, clammy skin. The patient will feel dizzy. Patient will have cramps all over the body. He may not be able to do his day-to-day activities. So in such scenario, the replacement is fluid. Now, how do we do the replacement? Like the patient is diabetic, Obviously, one would avoid fluids with sugar content in it. But when we look at electral and energal, although energal zero has got no sugar content in it, but the important part to consider is that when a patient is exposed to heat, he just not doesn't lose only water, he does also lose a lot of electrolytes in the form of sweat, which contains a lot of NaCl, that is sodium chloride. So one should replace not just the fluids but also the electrolytes. So otherwise the patient will develop electrolyte imbalance in form of hyponatremia or anything if there is excessive plain fluid which has been given to the person. So I would recommend that if a patient is non-diabetic, yes, you can have fluid replacement in the form of normal water, along with you can mix it with a pinch of salt and sugar, or you can have these available solutions like Energel Zero, Energel Blitz. If a person is diabetic, obviously I would be a little cautious about using sugar, but there are formulations available even for diabetic patients. So idea is to replace the fluid as well as the electrolytes.
Thanks. Dr. Saurabh, would you like to add to that?
Yes, definitely. In my hospital, Energel Zero, I have started using nowadays. But earlier on, I was not using, but started using nowadays, and the response is good. And especially in diabetic patient in my OPD, I have to see diabetic patients, and it does not contain glucose, and with a very balanced amount of electrolytes that it has, and without a preservative. So I think this is a good choice for diabetic patients.
I actually use this in my practice. It is a primary care practice that I do in a small town. And some of the commonest symptoms that our patients present with are ghabrahat, uneasiness, lethargy, energy, lack of energy. And when the patient comes to you, it is actually a challenge for the physician to differential diagnose. Is it heat exhaustion? Is it an anxiety neurosis or acute panic attack? Is it a transient ischemic attack that is about to develop? Maybe a pre-ictal episode that the patient has happened to come to you, or maybe unstable angina, anginal equivalents in people with diabetes. So you don't know how to figure out. And one of the easiest ways is to get the patient to sit for 15 minutes, ask them to take an energy drink, an electrolyte and fluid drink, and then ask them how they feel. Maybe you can check a blood pressure, pulse, and maybe glucose also if required after 15 or 30 minutes. 99% of the time, patients feel better. So it means it was probably heat exhaustion, some amount of dyslipidemia, dehydration. Patient goes back. And if patient says, no, doc, I'm still uncomfortable, I have a funny kind of a feeling in my chest, something is wrong, then you have to do an ECG, you have to evaluate further. So this is a treatment, and it is also diagnostic. So it is a theranostic tool for me. It helps me in therapy 90% of the times. And even otherwise, even if it has not helped in therapy, it will help in risk stratification and in deciding what kind of priority to give to this patient. The OPD is busy, and sometimes patients have to wait for an hour or so. So the physician assistants are also trained in advising which particular kind of electrolyte solution to which particular patient. So basically, they know the rules: diabetes versus non-diabetes, hypoglycemia versus euglycemia, and then they can choose. So that way also the patient gets a feeling that he or she is being attended to before his turn comes in the OPD. So these are ways where I use it. Other questions, Dr. Paritosh, another question coming from Dr. VK Goyal again. He says that in summer, appetite goes down for many patients, but they keep on consuming the same glucose lowering therapy. So in your experience, is this clinically significant? Does it cause hypoglycemia?
Yes, I mean, in summer season, do people do tend to eat less because because of the existing weather conditions, people do eat less, and those, especially those who are diabetic, those who are taking their oral medications. What we have been advising them in my practice, what do I advise them? Is that you have to think about what oral intake you are taking, what is the carbohydrate load which you are taking, and on that basis, if the patient is taking the same medication and if he is experiencing symptoms of hypoglycemia or he is getting these episodes of dizziness or sweating, then obviously we advise to reduce the medications, but it is not a blanket rule that a patient should reduce his oral medications. It has to be on a case to case basis. One should definitely ask that whether he is taking good food intake. If there is a reduction in the diet, because of the summer weather, then obviously you should tell them to monitor the sugar, and on that basis you can decide whether to reduce the medications or no.
So glucose monitoring will be required. Dr.
Absolutely.
Thakur Sangram Singh has joined the discussion, and but he has a challenge which we will request Rahul to address after this. So Dr. Thakur participated in the Enerzal Run or Ride Season 2. That is nice. 3 cheers, Dr. Thakur. But you have not received your winner prize. Now that is a gadbad. So you got even the medical certificate, the medal and certificate haven't come yet. So maybe Rahul will address this after the talk. But we'll make sure you get it, Dr. Singh. Dr. Saurabh, we just spoke about glucose lowering therapy and how the dose should be adjusted. From a North Indian perspective, antihypertensive therapy, diuretics, and adjustment in summer. What are the common challenges that you face? What is it that you do in the OPD?
So dose of antihypertensive drugs. Then again, I would rather say it has to be done on individualized basis, as sir said, from case to case basis. And if we see that on the same dose of antihypertensive drugs, patient blood pressure has started dropping. Suppose systolic blood pressure is going below 120 or 110, and diastolic blood pressure has dropped down to 65, 66. Probably I would like to decrease the dose. We have to be very careful in summers that blood pressure, many patients will come to us with the non-specific symptoms that like I'm feeling gabrahat, and when I'm eating there is when I'm standing from a sitting position I'm having vertigo, and all those subtle symptoms can indicate low blood pressure like gabrahat and a form of dizziness. So we have to routinely check blood pressure in those patients, and especially the dose of diuretics need to be decreased. Well, it's not a blanket statement, but generally I do prefer in my practice to slightly lower down the dose of diuretics in summer.
Dr. Paritosh, your comments first from a
Absolutely.
Mumbai perspective and then also from an indoor perspective, indoor management perspective.
Absolutely. So this is what Dr. Arora has said is perfectly fine. It has to be an individualized approach. One should get a good history regarding whether he's experiencing any symptoms of low blood pressure, whether there is any postural hypotension or drop in the blood pressure. Then an individualized approach has to be taken, and you can reduce the medications. Regarding diuretics, yes, obviously in elderlies and patients who cannot manage the fluid very well, patients with CKD, patient who are elderly, yes, diuretics have to be looked in, especially in summer season, because there is excessive loss of fluid through sweat as well. In indoor practice, if a patient is admitted and patient is experiencing some symptoms of hypotension, then definitely we ask them to monitor the blood pressure, and on that basis, as if the blood pressure falls below 110 or patient is experiencing symptoms, we do ask for reduction of antihypertensives.
So point well taken, and the focus would be individualized care, but you listen to the patient also. Of course, the signs will be there: blood pressure, orthostatic hypotension, but do listen to the symptoms as well. Dr. Paritosh, a question from Dr. Shashi Khare. Can we use carbonated drinks in diabetes? So maybe the entire spectrum of carbonated drinks that you are aware of.
Yeah, I mean, especially those which are not sweetened. I mean, carbonated drinks per se would not be a completely no to patients with diabetes. But yes, those who are sweetened, I mean, that should be avoided. But I would recommend that it would be my personal opinion that instead of these carbonated drinks, I mean, I would advise that if a person wants to drink intake fluid, why not plain water, or why not use something which is balanced with electrolytes, like for example, Energel Zero, something in patients who are diabetic.
So point well taken. No harm in taking them if they are sugar free, but we do have healthier alternatives available. Greetings to both of you from Monu Verma ji, from Dr. Monu Verma, and also from Dr. Satya Prasad Mukherjee, who thank you for the excellent quality of your deliberations, your answers.
Thank you, sir.
We have been speaking about hydration and health. We've spoken of heat cramps, heat exhaustion, heat stroke. But sometimes things become extreme, and then we get hyperpyrexia. So, Dr. Paritosh, what is the current definition of hyperpyrexia, and how do we treat it?
Yeah, so to define hyperpyrexia, one should know that what happens with the temperature. So body regulates the temperature. There is a thermoregulatory mechanism by the hypothalamus, and it maintains the core body temperature in a range that is generally between 36 point. So the upper limit is what we say is from 36.4 plus or minus zero point zero 0.04 degrees Celsius or 97.5 degree Fahrenheit. That is where it maintains in that range. So a fever, if you were to define fever, is any temperature. Now we have a diurnal variation. Morning temperatures and evening temperatures are different. So to define fever, studies have been done, and they have found that for most of the healthy population, the temperature remains below 98.9 in the morning, and in the evening temperatures, anything below 99.9 is considered to be normal. But anything beyond this is considered to be as fever. So morning temperatures more than 98.9 degree Fahrenheit and evening temperatures more than 99.9 degree Fahrenheit is considered to be as fever. This is what I am quoting from Harrison's internal medicine. Now, what is hyperpyrexia? It's an extreme form of fever, and the most important definition for fever is that there is a increase in the set point of hypothalamus. That is where it differentiates from other forms of dysregulation of body temperature. Hyperpyrexia is defined as any temperature more than 41.5 degrees centigrades or more than 106.7 degree Fahrenheit is considered to be as hyperpyrexia. Generally seen in patients with severe sepsis, but more commonly seen in patients with CNS disorder, trauma, or any injury to the thermoregulatory center.
So how do we treat hyperpyrexia? What is the difference between our approach to a 103-degree fever and a 106-degree fever?
Yeah, so if it is because of, now for fever, there has to be some trigger. There should be some pyrogen which causes it, or there's some reason for it. So for example, if there is a pyrogen involved, if there is any infective pathology, first you treat the infection, find out where the infection it is, treat the infection, and meanwhile bring down the temperature by using antipyretic drugs. So use of antipyretic drugs is most important in pyrexia and hyperpyrexia both. Use of NSAIDs, use of paracetamol. Then there are other methods where you can bring down the body temperature by using physical methods like cooling, evaporative cooling, or using of cold blankets, using of cold saline. If it is hyperpyrexia and patient is becoming delirious, or patient is showing that there is involvement of the CNS because of the fever, patient is altered, you would want to bring down the temperature faster. In such case, you can use cold saline, you can use bowel wash with cold saline, cooling blankets. These are some of the methods by which you can bring down the blood pressure, bring down the temperature, along with use of antipyretics.
Dr. Saurav, we have spoken about one extreme, that is hyperpyrexia, where of course the person has to be admitted and needs help from internal medicine. Let's go to the other end of the spectrum. Patients coming to your OPD and a history related to water. When patients tell you, Dr. Saab, I have developed a fondness for cold water, ice cold water, or I like only salty water. The only thing I like drinking is Golgappe ka pani, and I don't want to drink anything else. Or maybe I want to drink more water in the morning or in the evening. What does this tell you? What kind of endocrine diagnosis come to your mind when the patient talks about too much water liking, too little water liking, or specific water liking?
When the patient comes in an OPD, we have a condition known as diabetes insipidus. In this condition, patient will keep on drinking water, and patient will carry a water bottle along with him. And especially we have seen in patients with diabetes, craving for cold water can be there, especially in a summer months. So if a patient says that I am drinking water throughout the day, even during the night also, probably there is diabetes insipidus is one of the differential. And another differential where patient keeps on patient keeps on drinking water is some psychological disorder. And in psychiatric conditions, patients can have excessive drinking of fluids. So we have various methods to differentiate these conditions. Probably a salt depleted patient, like patient who is having Addison's disease, who is having postural hypotension, would like to drink more of the fluids with salt in it. will have craving for salt also along with the fluids. So we have different tests to distinguish between those conditions. Like we would see in patients with diabetes insipidus, blood sodium content in the blood can be high due to the preferential water loss. In patients with psychological polydipsia, we call primary polydipsia or psychological polydipsia. So in these conditions, patient can have low to normal sodium in their blood. And for a condition like Addison's disease, it is adrenal insufficiency. We can check the cortisol level and ACTH levels to diagnose this condition.
So you can actually get ideas about pituitary disease, about psychological disease, and also about adrenal disease. A similar condition, dry mouth, Dr. Paritosh, what does this say to you? Dry mouth.
So
Any
yeah, so
iatrogenic, any medical, any metabolic etiologies?
yeah, so dry mouth could be a manifestation of severe dehydration itself. Person has not consumed fluid for a long period of time. That could lead to dry mouth. Diabetes mellitus, for example, can lead to dry mouth. There could be a drug involved. Patient may be consuming some anticholinergic drugs that would be leading to dry mouth. These are some of the conditions which one should look at. So a medical history in terms of whether he's having diabetes, whether his consumption of fluid is good, or is he on some medication which can lead to dry mouth. Also, there could be certain diseases like, for example, Zika syndrome, or where a patient is having some connective tissue disorder, which can lead to dry mouth in a patient. So these are some of the things which one should look at.
Sleep apnea might be another cause of dry mouth.
Yes.
Would you like to speak more about that, Dr. Paritosh, for our audience? How do
Yeah,
we
so
suspect sleep apnea on history?
So yes, so
examination?
on history, if a person, yes, one of the important finding is most of these patients, if you look at them, they would be obese individuals, middle-aged obese individuals. They would have a disturbed sleep, and the family member will give a history that he's snoring too much in the night, and daytime somnolence is there. The person is sleepy throughout the day because he gets disturbed sleep. He has to get up in the night because of hypoxia. Family members giving a history of snoring, dry mouth. These are, and you may find a patient be hypertensive because of obstructive sleep apnea syndrome. So these are some of the things which one should look at when you are suspecting a patient with OSAS.
Dr. Saurabh, Dr. Paritosh just spoke about anticholinergic drugs. So you were speaking about diabetes. Which are some of the common drugs that we use in diabetes, in maybe neuropathy, which can cause dry mouth?
So the most commonly we use for the diabetic neuropathy, we use pregabalin, gabapentin, and if the pain and the sensory symptoms are not controlled, we can use amitriptyline. And amitriptyline, this is tricyclic antidepressants. Amitriptyline, norepinephrine, these are notorious for causing dry mouth. And sometimes we have to stop amitriptyline because of dry mouth. And even we have seen dry mouth with pregabalin also. Gabapentin.
Thanks. Another question coming in from Dr. Prakash. And Dr. Paritosh, please. How do you compare the intake of plain water with other fluids like cucumber juice, whey water, coconut water?
Yeah. So the total fluid intake, I mean, one should balance the losses versus the intake. To maintain a fluid balance, one should have a balance of intake and output. So that is how you will maintain the hydration of the body. Now, if you consume plain water, that is, I mean, you can, if you're consuming 100 ml of plain water, that the whole 100 ml will be counted as the fluid which is intake. But when you're consuming other form of fluids, I mean, in the form which also contain some solutes or substances in it, then obviously the entire amount won't be counted into it. But yes, fluid intake on an average should be amounting to, as what has been said earlier, around 2.5 liters in a day should be an adequate for any individual to take. That should include all forms, whether it is in the form of any juice or it is in the form of plain water. Also, one should remember at the urine output, and one should look at the physical activity that should also determine the fluid intake in a patient.
Physical activity is important. So if you're going to the gym, if you happen to be outside in the hot sun, if you happen to have to do physical exercise, be aware of that you have to sort of ensure that you are adequately hydrated, and also you have adequate electrolytes. Vinny Joglikar ji has also joined the discussion. So good evening, Dr. Vinny. And we've had so many questions today, so many interesting things. I, for one, would like to thank both of you, Dr. Saurabh and Dr. Paritosh. I've learned so many things from you. But if both of you could give me one take home for myself, I am a normal Indian. I work in a normal Indian city, that is Karnal in Haryana. What can I do to primary prevent my heat cramps, Dr. Saurabh? And what can I do for secondary prevention of heat cramps if I happen to get them, Dr. Paritosh? So, Dr. Saurabh, please.
Uh, the primary prevention of heat cramps, it mainly involves when we are going outdoors, especially in the hot and humid climate. So during that, we should have adequate amount of water. Hydration is very important, and not only hydration is important, but the amount of electrolytes also play an important role in preventing heat cramps. So both the amount of water and the quality of drink that we drink is important.
Thank you.
Yeah, so primary prevention, I think, as what Dr. Saurabh has said, yes, don't go out in the heat, avoid exposure to heat, be have shades, carry an umbrella. The secondary prevention, if you were to say, yes, heat cramps are associated with fluid and electrolyte loss both. So the secondary prevention will be to replenish the fluid and electrolytes. If you're having a lot of cramps, then stretch the muscle, like we have seen many a times during cricket. The batsman does get these cramps and they have to break the play. So at that time, stretching exercises do help, and yes, replenishment of fluid and electrolytes.
So fluid electrolytes and stretching exercises. Is that why, Dr. Paritosh, when you go to the gym, the trainer, emphasizes and re-emphasizes that you must stretchen up, you must warm up before going to exercise?
Absolutely, sir. Absolutely.
So lots of tips we have got from our experts today, from Dr. Paritosh, from Dr. Saurabh, not only about hydration, but about how to live a healthy life and also about how to balance life in the hot Indian summer. I have learned a lot from both of you, and I speak on behalf of everybody who is logged in today. Thank you for being with us. We look
Thank you,
forward
sir.
to having you again. And I'd like to hand over back to Team FDC. Yeah, Mr. Anang, not audible. While we wait for him to return, I'd like to. Okay. Thank you. Perhaps the audio was not all that good, but I would like to reiterate what Mr. Basu said. We'd like to thank everybody for being with us. I would also like to call out and acknowledge all the people who have made this hydration series a possibility. Of course, led by Mr. Basu and Mr. Rahul Bose from Rahul Desai from FDC. Without their support, it would not have been possible. The ideation, the conception, everything was from Mr. Basu and his team. And Rahul Desai has been a great anchor to have for this series. I'd also like to thank Mr. Prateek, who is the face behind our technical know-how, our technical platform. And from IJCP Group, Ms. Pooja and Ms. Tanuja, who are instrumental in helping us craft all these slides and in helping us convert this ideation into implementation, into something tangible for you. I take home the advice given to me by Dr. Saurabh and Dr. Paritosh. And if I want to maintain my hydration and my electrolyte status, then what I will do, of course, I will have home cooked beverages or homemade beverages like lassi and buttermilk. Both of them shared their favorites. Mr. Basu, your favorite is also buttermilk? And also, I will not hesitate to take medical grade energy drinks. which are full of water as well as electrolytes. And depending upon the glycemic status of the patient, we can always choose between Enerzal, which has high glucose, Enerzal Blitz, which has low glucose, and Enerzal Zero, which has zero glucose. So with this, I'd like to thank you once again for being with us. Look forward to meeting you again. Jai Hind.
Thank you, sir. Jai Hind.
Thank you, sir.